Can you please explain the condition stomatitis? My cat has this, and my vet recommends pulling all her teeth out, which seems cruel to me. Okay, so stomatitis in cats, that's just a fancy name for inflammation of the gums. And a little bit of gum inflammation is a normal reaction to having plaque or tartar on the teeth, because that tartar contains bacteria. But some cats have a condition that makes them almost overreact to plaque on their teeth. And in the old days, we called it plasmacytic lymphocytic stomatitis, but now it's just more commonly referred to as stomatitis. What causes it? Usually the problem is that cat's immune system is kind of defective, and it rejects the teeth as foreign. So it's an abnormal reaction of the immune system, or it's an autoimmune disease. So the immune system is responding in a more aggravating way than in a beneficial way. Now, feline leukemia virus and feline AIDS don't cause stomatitis, but they can make it much worse than usual. So anytime we have a cat with stomatitis, we're going to want to check and make sure it doesn't have one of these viruses that's making things worse. So how can we tell if this is what your cat has? Biopsies will definitely confirm it, although a lot of times we can tell just on physical exam that that's probably what's going on. Cats that have this, first of all, they have really bad breath. And I mean really bad. Like you can smell it from a foot or two away. And that's because the mouth is just so infected. In fact, anytime you smell really bad breath, it's almost always gum infection. The other thing you might see with stomatitis is bleeding gums. You might see that your cat drooling with a little bit of blood in the drool, or you might notice that when you touch your cat's mouth, it bleeds really easily. Sometimes people will say they smell a metallic smell, and that's the smell of iron in the blood that you can smell. Now, you might notice them crying out in pain while they're eating. And usually they will eat. They're not going to starve to death, but it's obviously hard for them to do. They might swallow the food whole, or they might kind of meow while they eat because it hurts. I had one in the other day who had this condition, and she would eat, and then she would hold her mouth open for a second before and I think she was trying to swallow that food over the sore gums. Sometimes you might not notice it while they're eating, but you might notice it while they're playing, because their instinct is to grab their toys with their mouth, and they might do that and then scream because they've forgotten how badly their mouth hurts. Might be dehydrated, because just like it hurts to eat, it also hurts to swallow. We talked about how they might drool, and sometimes it's bloody drool, but it's just easier to let the saliva kind of drip out of their mouth instead of swallowing. You also might notice that their coat doesn't look good, and that's because they have to use their mouth to groom themselves, and their mouth hurts, so they just don't bother grooming. They might be pawing at their mouth. They might snap when you try and touch them around their face. They might lose weight, obviously, because they're not eating as much. Sometimes they'll be wet on their front or wet on their paws, and that's from the drool. So what can we do? What if we look at a cat and think it has stomatitis, and then we do a biopsy and we confirm that that's definitely what it is? There's a bunch of different things we can try, and we usually start with the most benign stuff and then work our way up to the more drastic things like pulling the teeth that was asked about in this question. Antibiotics, very first thing we're going to do. And in particular, the antibiotic Zithromax is pretty effective against a type of bacteria in the mouth called Bartonella that is sometimes linked to this particular condition of stomatitis. So we'll try antibiotics. We might change the diet up a little bit, because sometimes the inflammation that you see with stomatitis is exacerbated by a food allergy. So we might try a hypoallergenic diet. We're going to recommend that you keep the teeth really, really clean. Remember, plaque gets hard and forms tartar within 2 days. So we're going to have you brush the teeth, or if the mouth is too sore to brush the teeth, we might get you an anti-plaque, like a germicide solution to rinse the mouth with. But the cleaner you can keep the teeth, the less it's going to cause the immune system to react to the bacteria in there. There are certain supplements that we can give you to kind of boost the immune system. Lysine is one that we real commonly use. And then we get into the more heavy-duty stuff. We can actually give medication that'll suppress the immune system. And in cats, we almost always go for the corticosteroids. So the prednisone, if they're really bad, there's one called cyclosporin that we can use. But that just suppresses the immune system and stops it from causing such horrible inflammation in the mouth. Now, the problem anytime you use prednisone is that if they get a high enough dose for a long term, it can lead to diabetes in cats. But sometimes we can get them down to like a half of a prednisone tablet every other day, and those cats do fine. There's not going to be any side effects from a super low dose of pred. We can do pain medication, although rather than hide the pain, I'd like to fix the problem. And that brings us to what the person questioned us about, and that's tooth removal. And I wouldn't jump to pulling the cat's teeth, but if everything else has failed and your cat's on a super high dose of pred and you're worried about the dangers of that, your vet might recommend having most of the teeth or sometimes all of the teeth removed. And the reason behind it is back to the common causes of stomatitis, which is that your cat just can't tolerate plaque. So if you remove the teeth, then there won't be any plaque, and then the problem is cured. And I'll tell you, about 80% of the cats that get all of their teeth pulled respond really, really well, and the stomatitis goes away. It might take a while. It might be 6 months or so before you can tell, but they usually do pretty well with removing all of their teeth. So I know it sounds like a horrible, drastic step, but you remove the source of the problem rather than having to give them medications for the rest of their life.